When we did our strategic plan here in, I guess it would be 2011, it was December of 2011 when it was adopted, we were very conscientious in going out into the community to hear from the communities what they thought or they perceived were the biggest deterrents to living a long, healthy lifestyle. And we heard from them very clearly. The largest contributing factor to whether or not we're successful in living a high quality, long lifespan is not necessarily our access to medical care, but it's the environment that we live in, and then to a lesser degree, the genetics. We in public health have been very active in engaging in what we call public health evolution, to look further upstream into these social determinants of health. As we look at our community, we've got pockets of poverty and we have pockets of affluence. How do we bring a balance to equal access as we look at these social determinants? So that's part of what we need to be addressing in public health, and it's a significant change from a public health department 30 years ago was very invested in healthcare, immunizations, follow-up to communicable diseases. Now our premature death is tied to cardiovascular health, cancer, and obesity, and diabetes, those types of things. Those are the types of issues that we will better address by looking at our social policies that impact those lifestyle changes and having a long-term sustainable change. You know, if you look at the national debate, and this is one of the problems we've got in public health, we need to change the national debate. If we know that 10% of the cause of premature death is tied to health access and health insurance, but the national debate, 99% of it has been about getting people insured. Very little debate going on in Congress about this 42%, which is these environmental factors. Those are some difficult discussions. Of course, politically it could be very difficult, but it's a conversation we need to have and we're willing to engage people on.